All right, I'm going to get us started. Welcome to Reading Public Library via Zoom. I'm Andrea Fiorillo, Head of Research and Reader Services. Susan Beauregard, RPL's Community Health Librarian, is also here tonight. A quick note about an upcoming program that we were going to host back in September that got canceled. It's been added back, and I've added the registration link to the chat. Finding Equitable Solutions to the Climate Crisis with Mass Audubon's Nia Keith is coming up January 18th. From HIV to COVID-19, the social and scientific response is part of RPL's Reclaiming Your Story grant, graciously funded by the Library Services and Technology Act. We're going to be recording this session, so please remain muted with camera off. If a question comes to mind, add it to the chat and I will ask at the end. I am honored to introduce tonight's guest. I want to give a shout out to my husband, Willie Lynch, for introducing me to Dr. Heller, and to Fenway Health for introducing me to Fabien and Paul. Our first guest, Fabien Denry, is a longtime HIV survivor diagnosed in 1987. Fabien was born in French Algeria. He came to the US in 1977. Fabien was a medical research coordinator. He served on the board of directors of the Boston Living Center, where he was chair of the programming committee. He subsequently served on the board of directors of the New England Association on HIV over 50. Fabien met his husband, Mark, who's here tonight, in New York City at the 25th anniversary of the Stonewall Uprising, and they joined their lives the following year. They were married in 2018. Fabien and Mark are serodiscordant. Paul Glass is a long-term HIV survivor, also diagnosed in 1987. Since retiring from Verizon, he committed himself to serving communities of color. He advocates for HIV AIDS prevention and care services for at-risk and infected individuals. Paul also works for LGBT older adults, especially elders of color, to receive healthcare treatment with respect and dignity. He is the president of LGBT Elders of Color. Paul serves as a member of the Mass Commission on LGBT Aging and 2 advisory boards for the Office of HIV AIDS at the Mass Department of Public Health. Paul is committed to ensuring that African Americans are included in shaping the future of HIV AIDS prevention and care. He has a son and 2 grandchildren. He lives in Falmouth and is happily married to his loving husband, Charles D. Evans. And finally, Howard M. Heller, MD, MPH, is a member of the Infectious Disease Division at Massachusetts General Hospital. He's assistant clinical professor of medicine at Harvard Medical School, teaches at MGH and the Harvard-MIT Health Science and Technology program. He is the senior advisor for clinical partnerships at the Mass Consortium on Pathogen Readiness. Dr. Heller is a fellow of the Infectious Disease Society of America, a member of the American Internal Medicine Infectious Disease Board, and the Infectious Disease Exam Committee. Dr. Heller received a bachelor's degree in biology from Columbia University and his medical degree from SUNY Upstate Medical University. He received a Master of Public Health from the Mailman School of Public Health of Columbia University. Please join me in welcoming Fabien, Paul, and Dr. Heller.
Thank you, Andrea, and thank you everybody for being here. It's wonderful that we have this occasion to talk about HIV and talk about something other than COVID after 2 years of being everything about COVID. And over the past 2 years, I'm a medical doctor. I specialize in infectious diseases. I've been very involved in the COVID pandemic over the last almost 2 years. And as I've been through it, there are a lot of times that I've reflected on the previous pandemic that started 40 years ago, the HIV AIDS pandemic. And when the first cases were reported in 1981, I was in my first year of medical school in Syracuse. So I got to see the pandemic roll out and evolve as it did over the next several years and decades. And as COVID was rolling out, the first thing that I thought of was, how do you know that an epidemic or a pandemic is happening when the disease has never been described before? And that's what happened in 1981. It was simply an observation by an astute clinician, infectious disease doctor in Los Angeles, noted that, he's just had a few patients who've had these unusual infections, especially this unusual pneumonia called pneumocystis. And usually doesn't happen to healthy people. And here he had a few young men with pneumocystis pneumonia. They all happened to be gay men. And this astute clinician saw that and said, something's going on. I don't know what it is, but something's going on. And he reported it to the CDC. The CDC reported it in their weekly morbidity and mortality weekly report that they send out every week of this observation. And once it was made public, we didn't have Twitter back then. We didn't have Instagram. We didn't have any of those. And once it went out, and all of a sudden doctors in New York and doctors in San Francisco and other places began to notice, gee, I've also just seen some young gay men with unusual infections. Not pneumocystis, but I saw one with cytomegalovirus. I saw one with Kaposi's sarcoma. And it was by just the observation and getting it out there that it became recognized there's some new syndrome out there and we don't understand it. But the infections and the problems that these young men are getting are ones that we usually see in people who have really severe immune system problems. And that was just a clue. And then the baby steps continued happening. And so at first it was just noticed in gay men. Some people were thinking it had to do with, it might be something sexually transmitted, it might be something environmental, nobody really knew. And then within weeks, it began to be noticed in other groups of people. It was noticed in people from Haiti, specifically Haiti, not the other Caribbean islands. Then it was noted in injection drug users, and people began thinking, well, maybe it's not just sexually transmitted, maybe it's transmitted by blood. Then it started to be noticed in heterosexual women. Then it was noticed in babies. And this took about 2 years for it to be recognized that this is not just something that is affecting gay men, but it's affecting a lot more people in the population in different groups. It then started to be recognized in other countries. And it just gradually rolled out like that. And back then, it took, when we think now about the desperation in the early days of COVID about, diagnostic tests, we don't have a diagnostic test. There was a diagnostic test available within 3 weeks of COVID being described. It took longer for it to be rolled out and be readily available, but at least there was a diagnostic test that we could use. For HIV, it took 4 years before there was a blood test available that could tell us if somebody had this disease. 4 years. For 4 years, people were walking around not knowing, do I even have this disease? Will I get sick? Will I have these problems? No way of knowing. The times were desperate. We would have these young people, mostly young people, some also middle-aged and older people, but predominantly young people who would start getting infections, pneumonia. They would get over the pneumonia, then they would get meningitis. They would get over the meningitis. They would have something called cytomegalovirus retinitis that affected their vision. And it was one infection after another, but there was nothing we could do to improve their immune system. So we could stave off, we could treat the individual infections, but eventually people would die, and it was pretty much a uniformly fatal disease. If somebody was at the point that they had one of these infections like pneumocystis or cytomegalovirus, they usually died within a year of that diagnosis. And so for years we had no treatment for the HIV itself. And what desperate people do, desperate patients, desperate doctors, is that we try anything. If something is observed in a test tube in a laboratory, we just go, well, gee, maybe it'll work in the person. So 2 years ago, when I start hearing people talking about bleach for treating COVID, and a lot of people thought that is just so outlandish and so ridiculous. What I remembered was back in the early 80s and mid 80s, and even the late 80s, almost 10 years into the HIV pandemic, people were using peroxide. That was the thing back then, because in the test tube, peroxide kills HIV, and we had no medicines to offer people. And so our patients were drinking peroxide. There was one theory and observation, humans are the only animals that don't synthesize vitamin C. Humans are the only animals that get HIV. Therefore, we need to give people megadoses of vitamin C. And we had patients who were ingesting 40, 50, 60 grams of vitamin C a day. No proof that it did anything, but without anything else to offer, people do desperate things. There were people doing hyperthermia treatment where they were passing their blood through a machine that would raise their temperatures to 105, 106 degrees to see if that would help kill the HIV and restore their immune systems. So when we start hearing about people using ivermectin and hydroxychloroquine and all sorts of other things, that there's no proof that these things work, but I've seen it before. I've seen when people are desperate, and if we don't have anything better to offer them, they will grasp for and try anything that they can. It wasn't until 1987, 6 years into the pandemic, that AZT came out. That was the first drug for HIV that was approved by the FDA. So we finally did have one drug, and it wasn't great. It prolonged life by a few months, and we would give it mostly to people with late-stage AIDS who had had pneumocystis or other infections, and it would prolong their life a little bit, but not great. We couldn't do testing readily in the lab to see if their HIV had become resistant to the AZT. We just knew that it didn't work very well. And then it took another 3 years for a second drug to come out, DDI. It took a few more years to do studies to confirm 2 drugs work better than 1 drug, but not great. It would prolong lives a little bit more than AZT alone or DDI alone. And every year or a couple of years, we began getting a new medicine. So one medicine after another, but none of them worked great, even when combined 2 together. And then it was 1995 that it was really a pivotal time that a new class of HIV medicines came out called the protease inhibitors. And when studies were done combining a protease inhibitor with 2 other drugs and having people on a 3-drug regimen that we began calling the cocktail or HAART, highly active antiretroviral therapy, that all of a sudden we were able to completely suppress the HIV, and people's immune systems could be restored. And all of a sudden, after 1995, 96, it became possible to treat the disease. This is 15 years into the disease. We're finally able to treat it well. But even then, these 3-drug combinations were oftentimes 20 to 24 pills that people had to take. Some of them had to be taken every 8 hours. A lot of side effects. So even when we had treatment, there were a lot of people who couldn't tolerate the treatment. AZT itself was very toxic, but with the other drugs, they worked well if people could take them. But that was really a turning point. And before I turn it over to Paul and Fabien to hear about their experiences, one of the other major differences with the way COVID-19 was handled compared to HIV is the government and politicians and others having any interest in dealing with the disease and doing anything about it. We didn't have an Operation Warp Speed for HIV. For COVID, within the first few months, there was Operation Warp Speed. Let's pour this money into it. All the labs were like turning their efforts. Everybody pivoted their lab to working on COVID. Several companies studying vaccines, and in less than a year, we had 3 vaccines available in the United States for it. With HIV, there was denial on the part of the government and others that it was a problem. Certainly not a problem worth investing money and resources into. It's affecting that population, not one that we really need to be that concerned about. So it took years for for the government and others to actually express an interest and put resources into treating HIV and studying HIV in the United States as well as globally. The issues about COVID vaccine availability in poor parts of the world. The exact same story happened 20 years ago with HIV medicines and the debate about whether we should be providing those medicines for some countries. So that's kind of my experience through HIV and watching it roll out, and how a lot of it was mirrored in what we just experienced with COVID. But I really am interested in hearing from Paul and Fabien about your experiences. What was life like for you in the 1980s? What was going on with you? What was going on with your friends, your family? Tell us about life in the 80s. I'll call on you, Paul. Oh, you're muted still.
Oh, okay. I'm muted now, and thanks for everyone for coming in and being a part of this discussion. For me, my diagnosis, as you was mentioned, was in 1987. But my life living with the experience of HIV, and as it was known back then, AIDS, HIV wasn't even part of the vocabulary in the public sector. Dr. Heller has given us a lot of information around the medical perspective and how it was viewed and researched, and the evolution of the medications that were available to combat HIV and AIDS at that time. But as a layman and coming into knowledge around what it was known then as AIDS, because once somebody somebody was kind of diagnosed, if you will, that it was AIDS. It was no such thing as HIV. It was just AIDS. I think I remember there was some terminology at one point about there was an ARC, and I can't remember what the acronym is for the ARC, but I do remember that being touted around within the community, that was the beginning of the end, so to speak. And if you got diagnosed with ARC, then it certainly translated and mutated into something much more serious, and AIDS developed very quickly. I've listened to Dr. Heller talking about some of the differences and some of the similarities also between HIV and the COVID-19. But one of the things that was extremely different between that we have not had the experience with COVID-19 was the stigma. And there was such a stigma around HIV back in the 80s and the early 80s particularly, but by mid 80s, it was pretty much running rampant, and it was very well known. And folks were really, folks within our communities, in the gay community in particular. And in my community, or the gay Black community, it was a scary time. It was very, it was such an unknown. We didn't know much about it. The medical the community didn't know a lot about it, and it certainly wasn't very assuring. If you got sick, it was pretty much a death sentence. And it was a difficult time because it was there was such a stigma attached to it that it was a gay disease, and that anybody who contracted it, if you weren't already known to be gay, you were certainly suspected that you were gay, and it was almost like being outed for being gay, whether or not you were gay, and as long as if you got sick. And that was part of the stigma that was associated with it, and a lot of that came with the stigma was also the fact that if you got sick and you were gay, you really deserved it because you shouldn't be doing those kinds of things anyway. It was a terrible, terrible time. And it was a time when people were, the difference I think between COVID and HIV is that folks, who got infected with COVID, they also survived. Many of them survived. There were those who didn't because of their compromised immune system, but there was treatment available, and there was there was some the emphasis on prevention. But back in the early 80s and 90s, there wasn't a lot of emphasis on prevention. It just wasn't really known, and certainly not very little was known about treatment. So, it was a very difficult time, watching friends and loved ones. And I can tell you, it seemed like at one point, certainly by 1990, I would seem to have been going to a funeral every other week for a friend. And these were, it was just, it was indescribable trying to convey to my feelings and my fears, and the fears of the broader community, all of my friends. It was almost like we were all waiting to hear who was going to be diagnosed next, or who was going to die within the next month or two. It was crazy. I was one of the lucky ones in this sense. With my diagnosis in 1987, my immune systems pretty much stayed intact. It wasn't compromised a lot, and I had my CD4 count, as it was known, and that was one of the things that was always watched. And if the CD4 count, if it fell below 200, it was going to diagnose as an official AIDS diagnosis. But mine stayed around 600s or more for years, and I have no explanation for it. Oftentimes, during over those years, I would just kind of wonder why it didn't, why I was spared and not others, and others weren't spared the way I was. But I just kind of kept on with the business of living. I had a young son at the time who I raised as a single parent in New York City. So I consumed myself with a lot of his rearing and upbringing, and was with also the cloud over me that at some point I would be leaving him, and I had to take. I was making provisions for him, financially as best I could, and with without sharing my diagnosis with anybody, including family members. So, but I always kind of gave them, asked for assistance from family members who were mostly back in Boston, where I was born and raised, to say, if anything ever happened to me, you have to promise that you're going to make certain that you take care of my son, and you're going to make certain that he's being cared for, and those kinds of things. So it was a real concern. But I was very lucky that my immune system stayed intact. The only person I ever shared my diagnosis with was my primary care doctor. And we had a pact, pretty much, that if at any point, because he was busy trying to convince me I needed to start a drug regimen of some sort, and the only thing that they had available at the time was AZT, and I think I forget exactly the other drug that Dr. Heller mentioned, but it was something like that. And said, well, we need to start early, and with early treatment. And if you want to consent to that, we can begin tomorrow. It's like, that's not going to happen, pal. My experience with and watching other friends who were kind of frightened into taking treatment for with the AZT. AZT, as was mentioned, was extremely toxic, and in my mind, that was one of the things that accelerated their death. So I was totally opposed to taking any drug, and but the pact was that if my CD4 count ever fell below 200, I would start medications whenever was available at that time. And it never did. I should say never, I can't say never, but it certainly took quite a while before that happened. And at the time, I was, all of this time, I was living in New York City. As I said, I was born and raised in Boston, but in 1979, I moved to New York and I stayed there for almost 30 years. But I had a career at Verizon, and I was, my career was moving. I was moving up with within the ranks of Verizon. So I was very conscious about not sharing my diagnosis with anybody, because that would that there was a very strong possibility that I could lose my job, I could lose my housing, I can lose my son. It was a lot was at stake, and it was not. This was not just hyperbole. It was real, because it was happening all around us. You know, there were a lot of the young men who I knew who, once they were diagnosed and word got out, even those who weren't really sick but were diagnosed, if it got it was known within their on their job, or they would automatically lose their employment. And for whatever reason, folks always felt as though HIV and AIDS was as contagious as the flu. And if you were diagnosed with HIV, you would definitely there's a possibility that you could catch it. Nobody wanted to touch you. They didn't want to shake hands, and there were no more hugs. They were in there. There was no support of any sort, and it was mostly it was just out of ignorance, and a lot of folks lacked the education around the disease itself. But for the most part, it was pervasive throughout every community, and I can only speak specifically about the community that I was mostly connected with, was within the LGBTQ Black community. And even there, it was difficult, because not everybody was very educated about the disease, or the only impact that they knew is that if you got it, you died. And that was where a lot of folks had their biggest fears. But even in the process of dying, you had no dignity. The dignity was thrown out the door. Nobody wanted to. It was difficult to get treatment. It was difficult to get any support when you needed the help, and you were too weak to fend for yourself, and you needed to have somebody to come and help with just the simple things of bathing and what have you. It was not many people wanted to be around you or be in the company. Only a few, soldiers, as I would call them, who really came to the aid of those who were in real need of home services. And now, if you weren't sick enough to be in the hospital, and you were lucky enough to stay at home for as long as you could, you still needed help. And there weren't a lot of people around who did it. There were a few organizations. I can remember there was GMAC, the Gay Men's Health Crisis. That was formed out of New York City. They organized teams of people who would assist and be supportive, and for folks who were known and diagnosed with HIV and AIDS. They would go and buy groceries. They would help them and come, and sometimes just for visitation, just so that they can have company, because it was a very isolating time. Once you were diagnosed, and oftentimes many folks were were very much alone. That wasn't just because of self-isolating. They were isolated from other community members, and they were shunned by family and friends. So it was that was a very helpful time for the organizations that had some compassion and recognized the need. They stepped up and made it happen. But overall, that time was very difficult. I see that when we talk about the COVID-19 pandemic and how the impact of it, particularly in our country, it just amazes me that how a lot of this is, I look at it oftentimes, and I've said to friends that, like I've seen this movie, I've seen this fears. I know how folks have, have these conspiracy theories and, make up things when there is, when there's, in spite of the medical evidence that to the contrary, then once they have something in their minds and they have their own idea of how things are and what how they what may impact them and what may not, their suspicions of the medications, then the lack of knowledge around the disease itself is just fear begets fear begets fear, and folks just it mushrooms and it becomes what was once a rumor becomes a fact, and those facts are usually most of the facts that folks were writing on or espousing on were false. They just things that were made up. They didn't they weren't real. But it's almost like the big lie that was being told around Trump losing the election. If you say it long enough and loud enough, eventually enough people are going to believe it. And unfortunately, that's kind of where we are with COVID-19, and unfortunately, why we, in my mind, why it's still lingering and have opportunity for all these variants to come about to mutate is because not enough folks to really believe in the science and believe that there is the treatment that's available that really is effective is to get us out of this pandemic. Unfortunately, there aren't enough believers for them to take the vaccinations and get us to where we need to be. So we're going to be stuck with this for a while. I think a lot longer than we really need to. And when I think about how long it was that we had to experience, no medications and very little, even though the few that came along early that were just extremely toxic, but there was nothing else. So folks who just out of desperation took what they could, but there was not a lot of opportunity for hope. And I think we right now in COVID-19 we got a lot of hope. There's a lot of reason to be hopeful because there are effective medications that are working, that are proven, and there just are not enough folks who believe that it's going to be helpful for a variety of reasons. Some folks I know that think about it from a religious perspective and rail against it because, well, it's not this is against my faith or this and I think they're just all the excuses, but that's my opinion. I think the more folks have have these conspiracy theories around the disease, and it builds fear amongst those who choose to be fearful. That leaves less room for an opportunity for us to come out of this pandemic with everybody being vaccinated. Certainly enough of us being vaccinated where it can stop the mutation of this disease. So I think that's I try to remain hopeful from that perspective, and that eventually we're going to enough people will come around and we can move forward in a sustained, rational, thoughtful way where we're not pitting against one another, and we're able to kind of get through this thing and not just use it as a political weapon.
Well, I think that expression of hope is a nice segue for us to hear from Fabien about your life. Tell us about your life and what was going on with you and your friends back in the 80s.
I was living with my partner, Frederick. I met him in 1984, and in 1987, we bought a condo in Riviera. That was supposed to be the first step, so condo, maybe a larger condo and maybe a house. This was our plan. This was April of '87. My parents came to visit in June of 1987 from France. And in September, I decided to get tested because the advice was anybody with a high risk group should be tested. I didn't feel at risk because I was in a steady monogamous relationship. So I didn't feel at risk, but I'm like, hey, what the heck? The hesitancy for many in being tested as the test became available around 85. Why do you want to be tested? There was no treatment at the time. So living with a sword of Damocles over your head, many people took their life because they had a positive diagnosis. So I got tested, and I was called. I was tested at Fenway in Boston, and then I was called to come in to get my result. And I asked one of my friends that had been diagnosed with HIV to come with me, and I got the result that I was positive. When this lady kept talking, I was not following anymore. It was a death sentence at the time. Doctors would tell you, get your affair in order, because there was no really any treatment and any hope. Frederick, when I came home, I was very concerned about how my partner was going to react. We had family members, for example, brother of a wife, and the husband would say, I don't want him in a house. We have a kid. I don't want him. He's gay, and he could infect organ. So there was really an issue how people would receive you, even among a rank among gay people. Once you had the diagnosis, you didn't want to share it because people would just keep you at bay. It was not this pouring of love, oh, let's be understanding. It came eventually when, thanks to gay and lesbian and some religious leaders who organized and said, we have to support those people. So when I told my partner, thank God he had a very nice attitude. He said, well, don't worry, if you have it, I'm sure I have it. And in December, he had a lesion in his palate, and he needed to do a biopsy between Christmas and New Year's. And so in the New Year, we got the result that it was KS lesion. And so at the time, we didn't know what KS was. We knew it was a form of cancer associated with older men on the Mediterranean, usually. But we were trying to live with denial. Well, they said it's KS. It's not HIV. It's not AIDS. It's KS. Anyway, we came back. My partner kept on working. He was never hospitalized. He followed everything that the doctor told him to do. He was able to have access to AZT in becoming a member in a medical research study. That the way he was able to get access to AZT at the time. And eventually, so he had radiation treatment for his palate, and eventually he had chemotherapy. And as soon as he stopped, so when during chemotherapy, he lost his hair, he lost his beard, he lost his eyebrows. And as soon as he stopped, within a few months, the hair came back, but lesion came back with a revenge. Eventually, he took back control of his life. He told his doctors that he was through. He was not going to do any more treatment, and he wanted to stop eating and to go that way. Some people may see that as cowardice. I see it as courage because he took back control of his life. So we had hospice coming to our house. At the time, I was working at Jocelyn. Of course, I was not working at Jocelyn. I was working at the East Boston Neighborhood Health Center. and nobody knew. I was not going to disclose to anyone. I was too afraid to lose my job. Anyway, he passed away. And I do remember that when I was holding his hand and he was going, I was wondering who would be there for me when my turn would come, because I didn't think I had more than 6 months, maybe a year. People were going so fast, and for whatever reason. So I went through that passage. One thing I would want to point out when we compare the two crises, the HIV and the COVID, there are some parallel and some contradiction. The parallel, what shocked me, especially during COVID, was the politics. The politics that we still live with the Democrat state being more vaccinated, the Republican state being less vaccinated. I don't think Republicans are less stupid or more stupid than Democrats, but they listen to their leaders. And we had the same issues at the beginning with the HIV, the AIDS crisis. You do remember Anita Bryant in 1977, the crusade to save the children. Jerry Falwell was in support of that. Pat Robertson was also injected in this thing. When Reagan got elected, it was because he had the moral majority behind him. And many people in his cabinet were part of religious organization. And those people were totally, they wanted, I have quote, they wanted, they were agreeing to treat people, only people who were in a normal, conventional relationship. That meant anybody who is gay was outside. I have here the man that for 8 years under Reagan was the person in charge. And later on, so his name is Gary Bauer. And for 8 years, he was, so let me read that. After reading the Reagan White House, Bauer became president of the Family Research Council and a senior vice president of Focus on the Family. Those two organizations are known to most gay people because even to this day, when gay rights have been accepted, marriage is accepted, those organizations are still fighting as much as they can to nullify, to void, to still consider us as criminal. So that was one of the big differences. And that may explain why the government didn't do anything. The way we were decried, several writers commented on religious construction AIDS, blaming the victim by defining AIDS as a punishment for sin, as a divine legitimation for proscription against homosexuality. I mean, so we would hear that. And we would hear also not in the White House, in Congress, debate about isolating gay people or people infected with AIDS because they were a danger to the population. And here we are seeing all our brothers, all people falling, dying. And usually religion is an outpouring of charity, support, understanding for anyone who is sick. And to get the absolutely opposite, pointing the finger at the people who are victimized. And the big difference was because gays were the people. This disease had been blamed on a sexually transmitted disease originally. And that was the big difference also, that everything that you described, Paul, everything that you described, Dr. Heller, was based on that. The discrimination, the stigma.
Fabien, I'm sorry to interrupt, but I mean, you talk about all the stuff that was going on at the high level in the White House and stuff like that, but it's painful to hear. You were working in a health center, and yet you were afraid that you could lose your job if they knew that your partner had AIDS. Tell us more about how did you make it through that? And at what point has that changed? At what point did that sort of attitude change in a healthcare setting?
Well, when I went to work at Joslin Diabetes Center, I certainly didn't disclose my status. I didn't tell to anyone because in my job, I had to draw blood. I had to be in contact with patients. People have this misunderstanding that possibly because you are the person living with HIV, you could be anywhere. I was not willing to take a chance and to lose my job because by now I'm by myself, I'm all alone. And I need to work in order to survive. I need to pay this condo. I got the inheritance of my partner, but I cannot just sustain that. And I did that actually for 10 years. Eventually, I lost my condo because there was a crash in the market. And the good thing is that when my health started to decline, I met Mark, my present partner. And also it was, so let me get back to what you say. So Frederick was working for the Charlestown, a company in Charlestown. They do a gypsum company. They do a board, plaster board. You see that when you go over the Tobin Bridge, you see those big stack of chimney, and you see all that steam coming out. That's where the plant is located. So he was the head of the accounting department, and they had presentation on HIV and AIDS. So he was a white collar, and most people were blue collars. They had education. He never had a problem with the people. He was never heckled. He was never, and they knew that he was getting sick because they could see his lesion. I was in a healthcare setting, as you said. I remember at the Joslin Diabetes Center, and this is years later, we had some AIDS patients that were coming because of the eyes problem. Because it's a diabetes center, he had a very good ophthalmology group. So we would have people, sometime in wheelchairs, coming for treatment. And I remember one incident where a doctor, they had wheeled a patient, and the patient lost control of his bladder, and he urinated. The doctor called OSHA, but the officer that was representing OSHA, and he said, I don't want to step in this and bring that to my house. So this is educated people, doctors, and when we are training, because we are training also in our place, we would see the employees, little people. We'd never see physicians. They didn't have the time, a lot of time to attend. So that was a difference in my experience. However, when I started treatment, I had a doctor that was a generalist, and he had no experience like most people. He learned as he was doing. His name is Dr. Bukebush. I had the luck to have him for 20 years, and he was just excellent. He kept on switching my medication because he didn't want me to become resistant. And at work, I had such trust. He would still be my doctor today if he had not moved on after 20 years, because his wife was a pastor and she was moving away. So my medical care overall have been excellent. We would always, in the beginning when I had problem, I would call. I was hesitant, on one hand, I'm like worried, is this, with all the opportunistic infection, every time something happened, you're like, okay, is that something I should worry about, or is that, so I would go and I would see my infectious disease, either the doctor or the nurse practitioner, and I would be like, I don't know what it is, but I have this, I have that. And they would say like, well, I'm sorry I bothered you, I don't want to, maybe I should not have to take your time. And they would always be reassuring. Anytime you have worries, you come to see us. It's no problem. You have to check those things. There is nothing wrong. And it was helpful because we were so in despair, and we were navigating alone, and we had no people to compare with or to talk with. Now I would like to talk also about the ASO, like the Boston Living Center. Larry Kessler was a legend in Boston because he is a fundator of the AIDS Action Committee. And so in Boston, we had really an early response. They didn't have much, but they organized, and we got a lot of gay people and lesbian, everybody getting together and helping the people who suddenly were losing their job, were too weak, to people who were independent, that had been financially successful, and now they were just destitute, didn't know, they were in a panic, and they were trying to organize their thing, and people were dying left and right, as you explained, Paul. So we're lucky on this. Then the Boston Living Center was also a nice thing. It was very helpful, also strange, because I have an issue that I was sharing with Dr. Heller and with Paul. Also, Paul and I were diagnosed the same year. There was a difference with us because also we don't know when we were infected. So maybe I was infected earlier, and maybe there are different strains, but I had to go on the treatment much earlier. Sorry.
You're talking about the different times that you started on treatment.
I had to go on the treatment, yeah. So as soon as my T cell level went below 350, this was a rule at the time, you started medication. I was put on NRTI, and I cannot blame those medications because they may have kept me alive. So I may be complaining about them, but I think they kept me alive. But I have to live with the consequences of them, the side effect. And one thing is called lipodystrophy. That was disfiguring. You could have built up a fat in your back. I've seen people, we had a block between their head and their shoulders. They could not move. It was a block of fat. They had problems sleeping at night. And a lot of us had lipoatrophy, big waste of facial waste. And I would refer to it as the scarlet letter of the epidemic, because anybody with knowledge could recognize a brother, that was living with this issue. So it was telling. But the biggest problem is that, because it's called, and you would be able more to talk about it, Dr. Heller, mitochondrial toxicity. So it's at the cellular level. It affects everything. And I have insulin resistance, I have high lipids, all of this, all those metabolic consequences, I think, are based on this, and they're compounding now that I'm getting older.
I'm sorry to interrupt, but there's so much that I want to talk about, and if it's okay, I want to get back to Paul, and specifically in talking about treatment. But Paul, you said something when you were talking about how when you were diagnosed and you sort of were determined to go on with the business of living. That was the term that you used, and I really like that, because there was a pivoting point where we didn't think of people dying of AIDS, but rather living with HIV and living with AIDS. 1995, 1996 was that turning point for so many people. How did your life change when the good drugs came out? You went on the good drugs, your viral load became undetectable, and you were determined to go on with the business of living. And I'm sure a lot of people who didn't do that, and they checked out and were just waiting to die. So how did that pivoting point change your life?
Well, it kind of goes back around the time when the cocktail came out. I was still very skeptical about taking any medications to help improve or to boost my immune system or to mitigate the HIV. So I didn't do anything I refused to take any medications around that time. I still felt healthy. I was in a very good health. I was being, being given, good checkups with my primary care doctor, all of those things in the mid 90s. So I made a conscious choice not to take any medications or do anything until things got, looked more bleak. And it wasn't until 2001, I'm a survivor twice. I'm an HIV survivor. I'm also a 9/11 survivor because I lived and worked in Ground Zero. And after, both planes came in and both buildings fell, and the trauma of the experience of that time and that day and those days, the subsequent days. By the time I went to see my primary care doctor again, about 2 months later, all of a sudden my test results came back, and my CD4 count was at 190, and it dropped from the 600s to 190. And it was at that point that my doctor and he said, well, you promised that once we got to this point, you were going to take medications. And I'm just telling you, things have improved so much. We've got better medications now. We got a new thing that it's a lifesaver for folks who are living with HIV. So we got to have, you made a promise, and I'm going to hold you to it now. And that was kind of when I said, well, I'll tell you what, I'll start for the new year in 2002. And it was in 2002, I took my first medication. And when I went to this HIV specialist, because you had to I was at that point being referred to the specialist for treatment. And he put me on, he said, well, my first visit with him was, he said, well, I'm gonna tell you, I'm going to start you on a medication, but I'm going to give you something right now before you leave the office, and I'm going to give you a shot. So this is for to prevent the pneumocystis pneumonia, and that it happened to be the drug Bactrim. Within 12 hours, I broke out in hives. I had a bad reaction to it. It's the only medication I ever had that I had a reaction to, including penicillin and everything else. And I was hospitalized with because of Bactrim. And it really just put the fear of God in me. That I said, see, I knew I shouldn't have started these medications. But it really was, I wasn't on any of the protease inhibitors or any of that stuff. It was just the Bactrim that really I had a bad reaction from. And once I got past that, and he calmed me down, and I was convinced that I really needed to stop the regimen. I finally did, but it was the stress of 9/11 took such a toll on me, and little did I realize how much stress I was under, and the impact of stress on the immune system. I had no idea that it could be impacted like that. So
So for you, your decision to defer therapy for you, that was the right decision. You spared your body many years of toxicity.
At the right time. Now, when I did start the regimen, and there was side effects, but they were relatively mild compared to many who I knew were taking the HIV combination drugs. I had problems with diarrhea and things like that. So, it was impacting the time that I would be in public, and, for fear that I may have an accident or something like that. So I was, I was very conscious about that. And I had a job where I was in sales, and I was in outside sales when my territory was Manhattan. So I had opportunity to, not have to punch a clock per se, and have to be at work in the work environment in an office per se. As it turns out, luckily for me, that my office went down with the towers, because my office was in one of the towers. So for months, I was, just kind of left to work at home for the most part. Once they discovered I wasn't dead after 3 weeks, that they allowed me to work at home, and we made contact through that, and I was able to mitigate the medications, or the side effects of the medications where that I was experiencing. I was able to do a lot of that from home.
I want to ask Fabien a question before we open it up to the audience to start asking questions. Fabien, so you're on medicines now. You're viral loaded. Your virus is suppressed. How often do you reflect or think about the HIV? Every day, many times a day, every week? How often does it enter your mind?
Only when I prepare for a talk. I reflect, like Mark's birthday is November 30th. The following day is World AIDS Day. No, November 30th, yeah. And World AIDS Day is the next day. So we always go from happy, and the next day is like remembrance, all the friends we lost, or my partner and such. So it's always a roller coaster, and of course we think about it. I think about it also when I go to seek treatment. Sometimes I have reminder. I don't want to take too much time, but usually I can change my mind, and I'm pretty happy person. So I'm pretty positive, and I'm very happy in my life. Also I'm somber in my presentation, but I have pretty life. I'm very happy to be here. I have wonderful friends in my community. I was so touched by many people who came and helped us when we were sick. One of them is in attendance tonight, and she was the groomer for my dog, and she was doing that free of charge, and we became fast friends, or we're still friends to this day. So I've been very touched and very grateful.
I really appreciate that you were able to say that you feel positive, because for many years, just that word had negative connotations. For somebody able to say that they're positive and mean it in a good way, not related to being HIV positive, is really great. I really want to give a chance to the audience. Anybody in the audience want to ask any questions of any of us? You can either unmute and ask, or you can put it in the chat, whatever you're more comfortable with.
So I have a question, if I may.
Please.
If you can hear me. So first of all, I always thank the Reading Library for these great programs. This is terrific. And I thank the three of you for working on the panel today. I've learned a lot. But the question I have, Paul mentioned that because AZT was poorly tolerated, some folks thought that maybe it would hasten their death from AIDS, and Fabien's late partner had access to AZT via clinical trials. So to do a little bit of that compare and contrast, what are people's experience in terms of the willingness that you've noticed to participate in experimental therapies for HIV compared to COVID?
Interesting. Well, I will tell you, my experience, and I have been involved in several clinical trials, since I started taking medications and moved back to Massachusetts. I left New York after 9/11 and moved here to Massachusetts, where I live on the Cape now. But I got involved with AIDS service organizations and with the in clinical trials out of Mass General, actually. And in fact, the medication one of the medications that I was on just previous to the one I'm taking now was the one I actually trialed many years back. And so, there were a lot of folks who, gay and those who were not gay, who were willing to participate in clinical trials to advance the treatment and prevention for this HIV. and it's ongoing today, which, you know, how we got to, you know, to get the drug for PrEP, you know, was folks who were involved in those clinical trials as well. And so that it is now something that is widely used and not really the fear about it being something that wasn't going to work, or that, you know, that it wasn't going to really be a preventive medication. It turns out it's working just fine, and a lot of folks are using it. We in order for us to get you know, the medication for COVID, there were a lot of folks who participated in clinical trials in order to justify the fact that the drug is it's working. It has and that it is not killing people, but it saves lives, and it does what it was purported to do. And there were a lot of folks who I would consider them brave foot soldiers, who just you know, in spite of the potential dangers, or you know, just because they felt it was doing something that was larger than themselves. And that was one of the reasons I did participated in the trial, because if it wasn't going to help me, there was going to be an opportunity to help somebody else.
Well, one of the pivotal points with clinical trials was actually Tony Fauci, who's been in this for a long time. And, you know, the early HIV trials, the early AZT trials were done primarily in gay white men. And a lot of other people weren't sure, is this going to have the same effect on people other than gay white men? And you don't know unless you do trials. And Fauci, it was in 1989 that he had a directive that all of the NIH sponsored trials, and then all the drug companies went on board. He made a rule that all clinical trials have to have at least 30% women and at least 30% underrepresented minorities. That you know, we've got to study these treatments in everybody. And another really pivotal thing was that he required that every city that was doing clinical trials had to have a community advisory board. And he was the one that extended a hand to ACT UP. This, you know, ACT UP is giving him death threats. So he was getting death threats 35 years ago. He's getting death threats now. But he was the one who extended his hand and wanted to talk with them and invited discussion with ACT UP. And he required these community advisory boards where every month the investigators, the scientists from every hospital in Boston, would sit around a table with representatives from ACT UP and the Committee of 10,000. That was the activist group for people with hemophilia. And the principal investigators from Mass General and Beth Israel and Deaconess would sit around a table and talk about the clinical trials and the drugs that were coming up. And the community, the people with the condition that we were trying to help, would participate in the decision-making about whether this was a good trial or not, if this trial was going to happen in Boston or not. And so including the people who you're trying to help, including them in the decision-making process from the very beginning, was a real pivotal point in making clinical trials better than they were in the early 80s. Still a lot of room to go.
If I may,
Please.
I would add, I have known many of my peers that joined clinical studies out of despair. It was either death or you try this medication. It might work, it might save your life, it may not, but at least you're taking a chance. That was one of the things that happened since I'm a bit earlier in this story. So that's why also you had so many gays, because it was very much like, well, maybe this will save my life. So I participated in a lot of medical research studies at MGH with Dr. Greenspoon and at TAF with Dr. Rubinoff. And a lot of them were observational studies. I was very afraid to get medications. But what I learned from those studies were exercise and nutrition really helped And he gave me motivation because I didn't want to be passive, just having to take my pills and wait for the world to go by. So controlling my food and doing exercise really gave me some hope, and I'm still doing it today. And despite my problem, I am still trying very hard to keep my shape and to live. I have a reason to live. I have my husband and many friends, and I'm not trying to aim toward longevity. What I want is quality of life. I would rather have 5 good years full of life than to have 10 if I have to spend 5 years in a bed. Thank you.
Amen.
Any other questions from people in the audience?
Come on, you guys, don't be shy.
I just want to say a lot of people have put up in the chat their gratitude for sharing your stories. Paul and Fabien, I think both of you had more than your share of heartbreak and healing and pretty profound loss and fear. And we are all benefiting from you telling these stories. So I want to share the feedback I've gotten, the gratitude for sharing that story.
Thank you.
Thank you.
You know, it's for me, I've been asked often, well, for folks who want to know what it was like back in the times when you know, when the AIDS crisis was raging, and it wasn't in those early days, and there was so much fear and so much unknown. I tell my story because it does. I've said this earlier, and you know, Dr. Heller, you picked up on it. But you know, there's we have a lot of reason for hope now. We have a lot of reason to be hopeful, and you know, we can be hopeful for. I know that you know, the HIV medications that I finally got you know, on a regimen for have saved my life. And it's not just saved my life for my health, because I'm, you know, my immune system is very stable. I'm undetectable, and I have been for many years. And you know, when it comes to, you know, just taking medications for it, you know, one of the things about COVID-19 is that you just get a shot and it's over. When the HIV, it's a lifelong medication. You have to take it every day. It's something that you have to, it's almost like, you know, if you have hypertension, you have to take a medication for it. There's not a cure, but you just get used to taking the medications. And you know, I'm on a once a day HIV medication, but guess what? As the older I've gotten now, I'm taking medication for a whole bunch of other stuff, and it's not HIV, okay? But in spite of all of that, I'm grateful. I'm grateful every day. Every day, as I tell folks many times, you know, my eyes open and my feet touch the floor, it's a good day.
You know, that sort of tweaks an emotion in me, because I mean, over the years, I've learned so much from my colleagues, but I've learned even more from my patients. Mm. And one of the really, really important things that I learned, and I was, so 1981, I was 21 years old, and I was in my first year of medical school. And I spent the next decade and a half primarily doing HIV care and seeing primarily young people faced with probable death, and watching and working with my patients as they would lose their sight, or as they would lose their ability to eat, or as they would lose their ability to travel. And when most of us sort of think about, well, gee, what would my minimum quality of life need to be for me to not want to go on? And some people will say, well, you know what, I can't ski anymore. I don't want to go on. And when you're well and aren't facing anything imminent, your minimum quality of life is whatever it is. But seeing so many of my patients continuously reassessing what they enjoy in life. And it's like, you know, I can't see anymore, but I enjoy being with my friends and listening to music. And constantly resetting that endpoint, and not yet being ready to die. And then many did reach a point, but I learned that nobody can really assess somebody else's minimum quality of life, and that everybody reassesses it constantly. And when we and our patients focus on appreciating what we have instead of dwelling on what we don't have, it's amazing what people can do.
Well, the word gratefulness, that's what Paul used, and it's certainly something I hear a lot and that we live with. And Paul and I, we don't know each other very well, but one thing we know is that he's a fellow warrior. He doesn't have to tell me all. I'm very grateful to hear your story, but I know we have gone through some similar battle. We had the same fears, the same hopes. I see ladies and guys, you know, we went through that, and we know we don't have to talk about it. We know we have something in common. And sometimes he gives us this kind of support, this kind of understanding that we don't have to put in word. A touch of the hand when we don't have COVID is helpful. The crisis of COVID, the isolation that he created didn't help. But thank God, through Zoom, I'm still able to see many people in my community and having exchanges, and that's really helpful. So that's something that we didn't have. Technology have changed, and it really helped.
I'd like to read one more thing that just came into the chat for everyone, from Susan. Hearing how positive you both have been through your journey gives hope and assurance that we can make it through this current crisis. Thank you for sharing that with us.
Thank you.
You're welcome. Yeah, we're going to get through it, and I'm confident we're going to get through it. We're going to get to the other side of it. It's just a matter of when, and I don't think that it's that far away. Maybe I'm an internal optimist, but eternal optimist. But you know, it's that we have faced a crisis like this before. As I said, we've seen this movie, so you know, and we got past the crisis of it and the fear of it. There's always going to be some lingering, and there's always going to be a few naysayers. But at the end of the day, there are going to be enough advancements, and then we're going to get on the other side of this thing. But so we have to stay hopeful and vigilant, and that's what we would do. We did during the AIDS crisis. We stayed vigilant, we stayed hopeful, and we stayed determined. And until we got the medications we needed that were life-saving, and here I am, proof positive that you know, all of that determination and steadfastness that people, you know, and the hopefulness that people had at that time, I'm a living proof of it. Here I am, just turned 72 years old, and never thought that I was going to reach 40. We'll get past this. COVID is it's something that we will get beyond, and then there'll be another disease to come around, and there'll be something as devastating that perhaps is COVID, but we'll get past that too. You know, we are, as humans, are very resilient. We're just humans with we have the human spirit is something that you can't count out. You just I'm always hopeful about that, and there are enough folks, even when there are many of us who have doubts, there is just as many of us who are fearless, and are determined to make things work and to make certain that we get our arms around this thing, and we're going to do that.
Thank you. I'm equally hopeful, but what I also think we all need to do, and everybody has a role to play in this, is to remember the lessons of the past so that we don't repeat them. That, if you learn about and think about and remember the stigma that happened with HIV and the xenophobia against Haitians, and then when you start to see xenophobia against Chinese people because of the China virus, that kind of stuff can't be tolerated, because it just slows things up and makes things bad for everybody. So I think with every pandemic, every crisis that happens, there's bad behavior and bad things happen. And if we remember them and address them, we can try not to repeat them the next time around, because there will be a next time around. I mean, we dealt with this with Ebola just a few years ago, and there was the the Africa phobia and the xenophobia directed to Africa.
Well, I wasn't around during this time, but I understand that there was a similar reaction to the Spanish flu, and and that didn't start in Spain. So.
No. Actually, there is a very good book called Flu by, I don't know if you know that one.
Flu, yes.
By Gina Colata. It read like a detective novel, not at all boring, very good.
And Michael, I love ending library programs with book recommendations. Michael Lewis also wrote a book. I think it's just called Pandemic. They're keeping those titles simple, but it's about the people who kind of could see a pandemic, the few people that could see a pandemic like COVID coming and started worrying about it in advance for all of us. And Michael Lewis is always a page-turning kind of read.
One of my favorite early HIV books was Randy Schultz and the Band Played On. He was a reporter for the New York Times, and he did most of the HIV reporting for the New York Times in the 80s. But in his book, he talks about what was going on socially in San Francisco, and then what was going on at CDC, and what was going on in the New York Department of Public Health, and what was going on in Fire Island. And he sort of intersperses these stories and weaves them together. And so you can see how all these different parts fit together in the early years of the epidemic. And they also made a movie out of it. But we'll talk about the book.
Around the same period, in the early days, there is an author called Paul Monette, and he wrote of his experience with his lover that was going through AIDS. And it's so beautifully written, very poignant, not trying to be a tearjerker, but really very realistic about what they experience. I don't remember the name of the different books, but Paul Monette, M-O-N-E-T-T-E, is really, I would recommend. But it's bleak, you have to be strong to read that. But it works well with the other rest. There's a movie also relating to the early period called Good Time Companion.
Long Time Companion.
Long Time Companion. And they chronicle also like the beginning when they see the first notice about a few gays getting sick, and there is a fantasy at the end when everybody, the friends, have this imaginary only a friend that they lost are coming back to life, and they meet on a beach and they're all embracing and kissing each other because suddenly they're reunited, and it's really lovely. A feel-good movie.
There are a lot of really wonderful works, theater, music. I mean, Tony Kushner's plays. There are just a lot of really good artistic pieces that came out of HIV and AIDS. And I was asking somebody last year whether, do you think we're going to be seeing the same sort of artistic expression coming out of COVID? And the answer was no. And a lot of people feel because the arts were so disproportionately affected by AIDS and so many people in the arts died, that is the reason why there's such a, you know, it's beyond La Boheme. It's we have so many ways that the suffering and the joy and everything has been expressed through the arts.
I wanted to say that the book that Fabien was speaking of by Paul Monet is Borrowed Time, an AIDS Memoir. And also that even though I think, Howard, you're right, that there might not be as profound an output for the arts, that during COVID, artists of all kinds got very creative about putting out their comedy, music, drama, even choral works via Zoom, which is amazing, dance, and offering it up. You know, you saw dancers dancing in their tiny studios in New York City, or artists doing all kinds of creative things online. But I think you're right, the more lasting works might not be made.
But it's
I
still
don't know.
early.
You know, the arts are always there for all of us, and there's such an expression through the arts that depict the times, and I think that I'm gonna go out on a limb and say that I think that at some point the arts are going to create something around COVID too.
COVID is only less than 2 years old, so give it time. I'm sure we want to be hopeful that something will come out of it that will be positive, and
we'll be buying tickets for a Broadway show. Trust me.
I'm like imagining the angels in America and perestroika of COVID.
We all sit in our living rooms alone. I don't know. Mark added in the chat that the first World AIDS Day was organized by major art museums around the world.
Well, there you go. There you go.
Yeah. All right. Well, thank you for coming out, and Paul and Fabien and Howard, thank you so much for sharing your time and your stories with us tonight. I know that you all could have spoken a lot longer because you have fascinating things to say. So thank you so much for what you did share tonight.
Thank you for having us.
thank you for giving us the opportunity. Thank you.
Good night.
Good night.
Good night, everybody.
Thank you.